Hi everyone, thanks for tuning in to today's webinar. I'm Kelly Torres with the National Environmental Health Association. Thank you for joining us today for the final installment of the chat webinar series, which stands for Communications in Environmental Health and Tracking. This webinar is pre-approved for 1 hour of NEHA continuing education for those of you joining the webinar that hold a NEHA credential. Today's webinar will explore communication tools and strategies used by tracking grantees to support and promote programs that use tracking data to inform and impact public health policy. This webinar features NYC Tracking program and California Tracking program. The New York City Tracking will talk about their air quality work that have impacted policy changes, whereas California Tracking will be giving us a briefing on the water boundary tool and how it might impact policy changes. We're showcasing two fantastic programs today that will hopefully inspire you and provide you information that will help you impact policies within your own jurisdictions using your own tracking data. During the first part of this webinar, we'll hear from California Tracking and the water boundary tool. During the second part, we will hear from New York City Tracking and their work on air quality and its respective impacts on policies. The webinar will then conclude with a Q&A session. A bit of housekeeping first. All webinar participants will be in listen-only mode. This webinar is being recorded. If you're not okay with that, you can disconnect at this time. There will be a Q&A at the end of the presentation, so we will hold all questions until then. Q&A will be conducted via the webinar chat box. Please enter in any questions you have via the chat box throughout the webinar, and we will address these questions at the end of the presentation. Just so you know, you can upvote questions. That's an option for you based on your preferences. With that, to ensure that we have enough time at the end of the webinar to take your questions, we'll go ahead and get started. So the speakers that we have today is, we've got Kelly Torres from California Tracking Program, who is an outreach specialist for the Water Systems Geographic Boundary Tool at the California Tracking Program. Kelly Torres is an outreach specialist for the California Tracking. Her UC Davis degree in nature and culture enables her to engage with various stakeholders, state agency personnel, and local county environmental health specialists to discuss challenges associated with data requirements. As the curator of the water boundary tool, she works closely with the team programmer to identify and design enhancements to make the user experience straightforward and intuitive. From New York City Tracking Program, we have Sarah Johnson and Nancy Jeffrey. Sarah is the Executive Director of the Air Quality Program at the Bureau of Environmental Surveillance and Policy at NYC Department of Health and Mental Hygiene. Sarah has worked for over 10 years at the Bureau and is in running spatial and statistical analyses to predict air pollution distribution, understand factors driving mosquito, rat inspectional results, examine associations between weather and air pollution exposures, and mortality/morbidity, and inform program planning and evaluation. She has been involved in the New York City Community Air Survey since its inception in 2008, and is currently the Executive Director of the Air Quality Program at the NYC Department of Health and Mental Hygiene. She has a Master's of Science in Ecology from the University of California, Davis, and a Master's of Public Health from Berkeley. Nancy Jeffrey is the Director of Outreach Project Management, Bureau of Environmental Surveillance and Policy at NYC Department of Health and Mental Hygiene. She has over 25 years of experience working in the field of environmental public health. She has conducted numerous environmental and occupational health investigations. Nancy has conducted risk communication in response to environmental emergencies and has created and overseen the development of educational materials on a wide variety of environmental health topics. With that, Kelly, I'll have you take it away.
Can everyone see my screen? Okay. Thank you for the opportunity to present the California's Water Boundary Tool. A little background about us. The California Tracking Program is in partnership with the California Department of Public Health and we're primarily funded by the CDC National Tracking Program, and we were established in 2002. Our mission is to mobilize data to improve public health, and some of our core functions are data compilation and management, data access and visualization, health research and analysis, health communications, and of course, education and training. But why drinking water? Well, we all realize that there can be a significant illness associated with biological contaminants in water. Little is known about the health effects from low levels of chemical contamination in drinking water. And sources of drinking water for populations really has to be known. And so we need to understand the distribution of that contamination, identify and characterize those communities that might be at risk, and examine the effects of this contamination in an epidemiological study. So when we began this collection, we realized that there was a lack of data for the community public water systems in California. There are over 8,000 regulated public water systems in the state. Many of these water systems lack digital files of their customer service area. They might have a paper map that may or may not be in an electronic format. There could be multiple versions of their boundary for a single water system because things change over time. And at that point, there was no single statewide digital map of all the public water systems in California. And there was also no mandate to collect for this information. So it made some questions very difficult to answer. You know, which water systems are supplied an address? Which areas are served by a particular water system? Which ones are on private wells? And then what drinking water contaminants may be exposure risks in a given location? So which addresses or systems should be contacted in the case of contamination or natural man-made disasters? We just didn't have good answers for those questions. So 2 people embarked on the adventure to develop the Water Boundary Tool. The vision: to assist water systems in digitizing customer service areas. And that again was to take that paper map or the paper map that had been converted into a digital format and create data. Compile all those pieces of maps and input them into a statewide digital map and make it publicly available. We began the planning and development stage in 2008, and we had a public launch in 2012. Prior to that, we mined the internet looking for any source of spatial data that we could find to pre-populate the Water Boundary Tool. And in 2014, we found there was a requirement for a needs assessment for national expansion. We had a tremendous loss. The original programmer for the Water Boundary Tool passed away unexpectedly, and we found ourselves looking at a new version, hiring a new program, and then deploying in 2015 version 2.0. We began the second data push and found in 2017 that as our tool expanded in the inventory of service area boundaries, we required a back-end and user interface redesign. Oh no. I'm having a series of problems. Oh no. Oh, here we go. Okay. So, planning and development. We found that we needed to outreach to state agencies and professional associations and collaborate with them on how to best address our redesign. And we pulled in some of our super users to test.
Sorry,
Yes?
can you please share your screen?
Oh. Oh my gosh. Okay. So it looks like I am having another issue. Oh. Oh my God. Hello?
Why don't I share your presentation?
Okay. Yeah, I seem to, there's the Wi-Fi is really odd today. I don't know what its problem is. And I think I completely lost.
Yes.
Oh no.
Is this where you'd like to be?
Let me see. Probably. I think I'm on slide, yeah, under phases. Hold on one moment. Oh my gosh. Okay. Okay, so when we began working on the redesign, oh, okay. There is, I'm going to see if I can. We collaborated with and provided outreach to state agencies and some of our professional associations, and we contacted our super users to assist us in testing the new redesign and informing us on functionality if it's working. And we did all this with dedicated funding from the CDC. So we launched the new version as well as new training and outreach materials because there was a slight change to some of the forms within the water boundary tool. And so we also have tool maintenance and enhancements. From 2009 to today, there are massive changes in technology. And so we required an additional staffing to make sure that the updating of the water boundary tool was smooth. And so data collection as well proceeded, and we moved forward with a new sponsor, Cal EPA, who assisted us in funding to collect for a special program that they are developing. So in the early days, our partnerships with the development of the water boundary tool were UC Davis's Information Center for the Environment, and they worked with the California Department of Public Health's Division of Drinking Water and Environmental Management and created this dynamic tool. And the Information Center for the Environment pre-populated the water boundary tool with the information we mined from the internet. And that was basically shape files that we got from Cal Atlas, and we joined it with a non-spatial database so that we could join the two pieces of data together and populate the water boundary tool. Now we are in a maintenance phase, and we get a little bit of help from the California State Water Resources Control Board, which provides us with a monthly CIDWIS update to make sure that the inventory in the water boundary tool is accurate, current, and shows all of the water systems in California. The water boundary tool is built on open source software We try to use those whenever possible because it gives us maximum flexibility, of course, cost savings. So we use GeoServer, PostgreSQL and PostGIS, Java Topology Suite, Google Maps API version 3. And some of the considerations is that it accommodates CIDWIS into our data structure. CIDWIS is built among a series of tables, so we had to redesign the back end to allow for that. And so also the incomplete and outdated CIDWIS context, we had to make sure that the conflicts were resolved. This is the splash page of the water boundary tool.
Kelly,
there's a view Hello?
Kelly, what slide are you on?
Oh, I'm on slide 12.
Just let me know when you want to turn to the next slide.
Okay, so slide 12, this is our splash page of the water boundary tool. You can view, download, edit, and then learn more, of course, is our FAQ section that has instructions and visual tutorials. The view section is a map interface where you can filter to view water systems by county, by district, by local primacy agency, or just one water system at a time, and you can view it on the map interface. Next slide. So who can use the water boundary tool? So when a user wants to edit and enter data, that requires registration. If you just want to download the data, that also requires registration. However, if you just wanted to view the data on that map, that's publicly available. There's no registration required. Next slide. Data collection. And let's go to slide 15, back to the splash page. I'll give you a quick view of what an editor user sees when they access the water boundary tool. Next slide. Depending on the permission levels and the jurisdiction of a water system user, owner, manager, or operator, the water system inventory list that they will see on their page can be small, short, or very long. I have statewide access, so I have accessibility to every single water system in the state. You can view it. Every water system has an ID number, and of course a name, and then we've got a column that shows the district that it falls into. The completed column tells us that if there's a check mark in place in the box, that there is a service area boundary record available for that water system, and it was entered, it is current, and it is complete. The verified column is a performance assigned to a district chief. They have the last say in viewing that the water system in place, the boundary in place for that water system is verified. And then, of course, the last column tells you the number of boundaries a water system could have in the water boundary tool. Next slide. Boundary already in place. So if there is a boundary record already in place, you will see a record towards the bottom of the page. If there is no boundary record in place, you can select Add a Record in the upper right-hand corner and either draw directly into the water boundary tool or upload KML or shapefile data. And this metadata field displays the boundary particulars and who drew it, where the data was found, and when. Next slide. If a boundary was drawn and you leave and exit the site, but after a couple of weeks require that it needs some tweaking, you can go back into the water boundary tool, access the editing mode by selecting the pencil icon, next slide, and make changes to that polygon. You click the polygon and nodes will appear all along the perimeter of that polygon. And you can click on a node and just pull it to the place where the boundary has changed. And then you have to make sure that you enter a valid date range, the beginning of the time that this boundary is valid. Leave the ending date open because that will be something for a future operator, owner, manager to go in, retire this boundary by entering a date in that field and marking it no in the most current area that that retired boundary reflects an older place in the past. And then we have little question marks in each section that describes how to make the selections for those steps. Next slide. So basically, the Water Boundary Tool editor allows registered users to create, edit, and retire obsolete service area boundaries. Which is really fabulous because now we are able to conduct research that tracks boundaries as they change over time. We additionally collaborate with other users to improve and assure the accuracy of every one of those boundaries. You can download a KML file and view the boundaries on Google Maps, as well as export digital files of the customer service areas. One of the things that we're going to look at in the future as an enhancement is the conflation tool. As we build data files, there is a requirement that would be really great to have to batch upload a number of service area boundaries for separate water systems at the same time, instead of doing them one by one. That takes a little bit of programming. And future enhancements will be drawing along a street or property lines, excluding areas within a polygon, like drawing a donut hole in the middle of your polygon, and continuing to collect data and administer QA/QC to the data already in place. Next slide. So who can edit which systems? It is role-based, so water system staff, water system wholesaler staff, regional staff, and state staff can read, write, and access the water systems in their jurisdiction. They can mark them as completed. They can retire obsolete boundaries and upload more current boundaries. And the regional staff are the selected personnel that have the ability to verify that last entered boundary. Next slide. So we make sure that every water boundary tool user has authorization and can enter data, and they mark the boundary is complete and ready for verification so that the district engineer or an LPA administrator can go right in and verify that service area boundary. But some considerations we have to take are that the main point of assurance is to ensure that users are appropriate before authorization. So that means that I will send an email to someone who is seeking an account to find out who they are, where they're from, so on and so forth. But the challenges that we've had with verifying the boundaries in that regional staff is that there's changes. People retire, people get a new job, and so the data contained in CIDWIS isn't necessarily updated on a monthly basis. So requests go unchecked. But then the water boundary tool staff, we also make sure that we check the data frequently for anything that might appear incorrect or strange. There have been those issues, and we make those changes. Next slide, data management. So there can be multiple boundaries entered for a water system because water systems change. And and every new boundary has to be marked with an applicable date. If there's a new boundary, if a water system has a boundary in place, it isn't current, it is retired, and the new boundary is uploaded. And there can be multiple users that have access to a single water system boundary. So they have to work in collaboration amongst themselves to make sure everything is current and accurate. So having multiple boundaries and users per system enables collaborative data entry, comparisons of areas to neighbors, and the changes of that boundary over time, which gives us a collection of historical data. Next slide, public data, which basically takes us to the download page. Again, you have to, okay, next slide, download data. Anyone can sign up for a download account. This data is public, and you sign up for an account, it is approved right away, and then you have the ability to download by one water system at a time, download all the water systems with a service area boundary for a county, for a district, or for an LPA. To get more concise data, you can filter other options by population served or by number of service connections. Next slide. Then you click preview and your selection appears on the map. When you're ready to download, you select the format you'd like, either KML, a CSV, a shapefile, or GeoJSON, if that is something that has been previously arranged. And you'll get a file, and you can then sort it and clip it according to the needs you have. Next slide. So the Water Boundary Tool Downloader, it allows registered users to view current data. It's updated nightly. If I was to put in 10 new service area boundaries per water system today, it would be updated tonight. You can download a data set in multiple formats, and you can download only the current files and preview it in that map interface, or you can download everything, which will include all that legacy data. So in conclusion, we have had, since 2009, we have had a variety of benefactors helping us fund the development and maintenance of this water boundary tool. The stakeholders, we make sure that we engage them regularly for their needs and buy-in and create partnerships that have been very beneficial. So public versus confidential data in California, water system boundary data is not confidential. And even though confidentiality may impact user registrations, you know, like IT security measures, etc. But data collection, it's helpful to pre-populate the data set. And we have done that over the years with crowdsourcing. And as I mentioned, other sponsors who have had a particular research study in mind where they are looking at a focused group. But really we can't rely on crowdsourcing alone to complete our data set, because the water boundary tool requires maintenance and staff to make sure that all of that is taken care of. And last slide. How has the water boundary tool been used so far? Well, as I stated earlier, there are over 8,000 drinking water systems in California. And we have been successful in collecting 5,392 of those. That includes current and legacy data. And what's really fantastic is that that inventory is showing that we're serving over 90% of the population of California. We have over 4,500 users, registered users, who can download boundaries and download and edit, and 379 of those are specifically for data download only. So we have more people downloading the data than entering and updating surface area boundaries. And so as we look forward to enhance the program and the policies, this is, you know, we look at water affordability, nitrate pollution in agricultural communities, cumulative impacts of that in environmental justice screening. And we have been able to support drinking water management activities like water supply permits, sample siting plans, reporting requirements, consolidations, which is going on right now in California. And we can also assist in identifying the locations of private well users. In California, those wells are not regulated, so it is a little bit of a mystery, you know, how those residences and communities are, you know, handling everything. And drinking water quality and wastewater management planning, as well as, of course, emergency drought planning, which we experienced over the past several years. And the then Governor Brown had a very, very particular interest in. So, and so lastly, we have our current partner is the Office of Environmental Health Hazard Assessment, or OEHA, and they work on behalf of the California Environmental Protection Agency, and they created a tool called the Cal Enviro Screen. And what that is it identifies California communities by census tract that are disproportionately burdened by and vulnerable to multiple sources of pollution. Another organization that uses the data from the water boundary tool and that has also pushed some legislation is the Human Right to Water that is pushed by the Community Water Center of California. And they are a member of the Safe Water Alliance that is sponsored by AB 685, the Human Right to Water. And so legislation was signed into law by Governor Brown in 2012, making California the first state in the nation to legally recognize the human right to water. And AB 685 is now Water Code Section 106.3. So it again recognizes that every human being has the right to safe, clean, affordable, and accessible water adequate for human consumption, cooking, and sanitary purposes. And with that, I have just concluded my presentation, and we can move forward to the next presenter.
Thank you, Kelly, for that wonderful presentation. I will now let Sarah take it away.
Great. I'm going to share. Am I just hitting the green share button?
Yes, please.
Oh, sorry. Okay. Thank you. And so today, Nancy and I are going to talk a little bit about how we have worked here in New York City through our tracking program and through one component of the tracking program, which is the New York City Community Air Survey, to influence, or at least try to influence, policy that has been developed here locally and regulatory, provide guidance to those who are doing regulatory work. So in New York City, there are several networks for monitoring air quality. The first being the New York State Department of Environmental Conservation. This is regulatory monitoring to ensure that the city is in compliance with the Clean Air Act. The monitors for that are relatively few in the city. You can see a map there with the green points on it. Those are our regulatory monitors. There are only 14 sites. They are all on rooftops, and they monitor the criteria pollutants. So that's fine particulates, PM 2.5, ozone, NO and NO2, which are combined, they're called NOx, sulfur dioxide, and volatile organic carbons. So back in around 2007 or so, folks here at the Health Department really, stemming from this idea of environmental public health tracking, one of the real gaps that was seen, that was here in New York City, is an understanding of what the air quality is like at human being level, not on rooftops, because no one actually lives or works on the rooftop, or I suppose roofers do, but relatively, you know, most folks in New York City are down on the sidewalk, and that there is a recognition of there being a lot of variation in air quality across the city that was not being well captured by the regulatory monitors. So we developed this network called the New York City Community Health Survey, and these are mounted on street light poles at about 8 to 10 feet high. So they're, you know, that would be a very tall person, mind you, but it's high enough to so people can't really mess with them too much, but we're still capturing more or less what people are experiencing. And then we sample at those locations, you know, up to about 150 monitors across the city. Those numbers have varied over time depending on funding. And we can do some modeling, some statistical modeling using land use variables in order to produce surfaces that you see up in the on the right-hand side, the red to yellow map, that gives us an understanding of how the air quality varies across the city. Mind you, the data that we're collecting is we're not able to it's not for regulatory purposes. We aren't enforcing anything using this data. It's simply surveillance. And so we've been collecting this data since 2008. And so now we have over 10 years of local data. And the question is, how can we use it? It's great data. So here, in general, the legislation is law that is enacted by a legislative body at the national, state, or local level. And here in New York City, that is, the local level is the New York City Council. And, and it functions much like other, higher level government entities, but, one of the roles that we can play, being the health department with this great data set, is that we can negotiate positions or comment on bills, which is how we see our community air survey data as really playing the greatest role. So I'll give you an example. In 2009, the Environmental Defense Fund, which is an NGO that is located here amongst other places, they released a report on dirty heating oil in New York City. Specifically, this is fuel oil number 6, or residual fuel oil. This is the heaviest, and meaning the darkest, the blackest, as you can see in this slide, of the heating oil that could be burned in building boilers. Generally speaking, it's in a single family home wouldn't be burning this. It's these large multifamily buildings. But it is significantly more polluting than the lighter heating oil or natural gas or, other forms of heat, which actually in New York City, we have a steam network that heats some buildings with steam generated from one of our centralized steam generation plants. But so here was this nonprofit that released this report on just how very polluting this type of residential fuel oil is, and how it was being burned by quite a few buildings in New York City. Now, about that same time, we released our first results from the New York City Community Air Survey, and we saw in our monitoring and our modeling work that indicators of counts of the number of boilers, buildings with boilers burning the heaviest, this residual fuel oil, was a very good, could explain levels of sulfur dioxide and PM 2.5, the fine particulate material in the city. Now, this is like correlation information, right? It's not necessarily, we weren't doing like an engineering study where we were fitting a very complex modeling system, but the data that was generated out of this community air survey, really strongly suggested that you're going to have more air pollution in parts of the city where you have more of these buildings that are burning the heaviest fuel oil. So, and you guys can see this in the map that's on the screen now. And just for all of you who may not know New York City, which, is sometimes we forget here in New York City that there are people who are outside of New York City. But you should laugh. It's cute. This is a cute, laugh. But that Manhattan is very, very darkest little island that's shaped sort of like a hot dog. And you can see many, many blue dots of the buildings burning number 6 fuel oil. And also it's, it's darker brown where that has higher fine particulate concentration. And you can, the other dark brown areas in the city are all, concentrations of buildings and also high traffic areas, which is, of course, traffic is another source of PM. So, we wanted to take action there was a general feeling that outside of just the health department, I mean, in across the city, you know, the agencies in the city and the council, that this was enough information to think about taking action on this. But the health department, in fact, does not, in the administrative code of the city, the health department, you know, has no regulatory power over sources of air pollution. And so, which is where the red X is on this slide. But the environmental protection, the Department of Environmental Protection in the city, who is the one that enforces the air code, they are the one that allows for some control. And then also there is code that dictates around climate protection here in the city. So the health department itself wasn't going to be changing our health code, because that was in our jurisdiction, but we could influence and try to inform the other sister agencies and the council. As yes, so we needed to establish these relationships, become, you know, come to the table, get a seat at the table where we could bring our data and help to get ourselves heard. And lo and behold, very excitingly, after a couple of years and much negotiation, clean heat legislation was passed, and this was a real success. We felt for where we felt that our data was actually respected and heard by the policymakers, and so there was an absolute abolition on prohibition on buildings burning the residual fuel oil in the city, and then there was, you know, buildings were required to switch to lighter fuel oils over time. We provided some, as part of this legislation, there was also loans and other assistance, because it did cost. There was, you know, pushback from landlords because it did cost money in order to convert their heating systems from one type of fuel to another. But we continued to use our data and what we knew about levels of pollutants in the city and the importance of the indicators of the residual fuel burning buildings, the locations of those, to help to argue for more incentives, or incentives targeted to certain neighborhoods where we really felt there would be the biggest bang for the buck as far as conversions go. And so that was a great example of the use of our data in affecting regulation. Now we've also, another example is looking at cooking emissions, and this is emissions from char broiling in commercial establishments, so in restaurants. And this is your typical Burger King, or you know, they tout their flame broiled burgers. Well, that flame broiling produces quite a bit of fine particulate emissions, and interestingly enough, there are emissions control devices that can be used in commercial restaurants and commercial settings in order to reduce by 85% the amount of particulates that are released. But there was no requirements that those be used. And so we, through NYCAS data collection and some of the modeling that we had done, statistical modeling, looking at how, when we estimate cooking emissions from char broiling across the city, we see that it's, you know, significant, that areas with more cooking emissions have also higher levels of fine particulates, which is, you know, this is cooking emissions going on inside a restaurant that are affecting the ambient air quality in that area of the city. And that the emissions produced by, cooking a hamburger are significant and much greater than what is coming out of a truck, say. And trucks and cars are required to have emissions controls, right? And so why not commercial cooking? Well, bringing all of this data and all of these arguments to, again, to City Council and through the and to the Department of Environmental Protection, who again, they are the ones that have the jurisdiction over the air code here in New York City. We convinced them that it was definitely an item that was important to consider. And now, in 2015, the air code was changed to include a requirement that new commercial charbroilers or existing chain-driven charbroilers that cook more than 875 pounds of meat per week. Now, that's a lot of meat. We recognize that. There is, of course, compromises had to be made because of the restaurant industry and the concern about being overly burdensome on small restaurants, things like that. And so, but the control that, because the control devices are a cost, they do cost something. And but we did get that passed, which was again a win from our point of view of using data to bolster the argument for a change in the code. One of the things when we're communicating with the policymakers here in the city and is around air pollution specifically is the fact that neighborhoods with the spatial pattern, the pattern of air quality in New York City is different from the pattern of the burden of health effects that might be caused by air pollution. So in these two maps, the point, if you look on the map on the left, where the highest that shows the concentrations of fine particulate matter across New York City, and you can see, the dark blue areas, which are Midtown Manhattan, lots of big, tall buildings. It's your typical Manhattan scenery, lots of traffic. And then on the right is the PM, or fine particulate attributable asthma ED visits. And the parts of the city that have the highest, the dark blue areas, are different. And that's because the most polluted parts of the city are not necessarily where the most vulnerable folks live. And so when we are communicating with policymakers and they want us to identify what is the, give me the top 5 neighborhoods that are most polluted, and we'll concentrate we'll target those areas with our policies, we come back to say, well, we really want to improve the health of New Yorkers, we need to think about where the burden is greatest, where there's the most pollutant attributable health outcomes, and maybe target those neighborhoods or a mix of the two. And that can often be an extensive conversation and understanding that, because it is a different list when you sort by these different variables, these different outcomes. So I think, and this is again making the same point. When we look at air quality, it's very similar across the neighborhood poverty. So poor and rich neighborhoods in New York City have very similar air quality. But when you look at the health impact of that poor air quality, it's much greater in the poorer neighborhoods. You can see the plot on the right, the chart on the right, how much higher the high poverty neighborhoods have this is asthma or ED visits. And we always want to take that into consideration when we're advocating for policies that would impact air pollution in New York City. And so when we're having these conversations, we're having access to our environmental health, environment and health data portal, sorry, is always very helpful. I'm going to switch over to that now so I can show you guys a couple of things we really like in our portal that are very useful. So, you know, we're able to simply look at, this is a table of neighborhood air quality. So this is where, you know, I've sorted ascending. So the highest neighborhood for 2017 annual average, you know, is Midtown Manhattan and some parts of Manhattan. But if we were to choose the attributable health outcomes like asthma ED visits, it would be, instead it would be South Bronx that would be at the top of the list. And so being able to pull up these charts is really, really helpful. And then we also try to communicate with neighborhoods. Often there's the question of, well, what about my neighborhood? Well, the traffic in Sunset Park is really terrible, and it's worse than anywhere else. And so one of the things that we have on our portal, which we find to be very helpful, is are these neighborhood reports, which allow us to pull up, you know, a sort of a summary, which, what's that?
I think it may be hidden under the.
Oh, sorry, it's under my, I can't get to it.
Is the neighborhood?
Is that? No.
Oh,
that's
no.
not.
Okay.
Sorry, you know what? We always,
refresh.
you know, we tested this and then it always gets stage fright. The portal often gets stage fright.
We'll have to refresh it.
Let's see.
See what we get.
It's waiting.
There
but this will come up soon. Here it is. Where we can see how the neighborhood is doing in relation to other neighborhoods in the same borough or in the city as a whole. And you know, we have a nice color coded to let the user note it, kind of quickly grasp whether or not the air pollution, for example, is worse or better or middle of the road compared to other New York City neighborhoods. This neighborhood is sort of a good example where you have worse air pollution here, but then you actually have the health burden is just middle, except for cardiovascular hospitalizations. And we allow folks to see, you know, often the perception is, oh, it's getting worse here. It's getting so much worse here. And so we, you know, include the trend over time to be able to demonstrate whether or not that is the case, but through NICAS monitoring, are we estimating that the pollutants are increasing or decreasing over time in that neighborhood. And then finally, the last piece is we develop data stories. And Nancy, I think, is going to talk about that a bit.
Yes, hi. So one of the things that we want to do is be able to help our users understand and get a way of engaging. We wanted to figure out how we could use some of our online data to help engage with the public so that they could learn more about environmental health issues in New York City. So we came up with the approach of, we're calling them data stories. Originally, when we first started the effort, we kind of were starting off doing more of an infographic approach, but they've evolved over time to be able to show a little bit more of a story. And I'm going to just illustrate on the landing page for our portal. If you go up under the red symbol and infographics on critical topics and go there, we've developed 4 of them so far. And the one I'm going to highlight today is our traffic infographic. And this is based off of findings and from our NICAS program, but also from a report that was published in 2016 that talks about data, I think in 2015, looking at the public health impacts of fine particulate matter from traffic pollution. We designed this in-house, and worked with our communications office on the wording to try to make it a little easier for people to understand and get a little bit of sense of why is public health, why is air pollution important for public health. So we go through the beginning stages of a little bit of what is PM 2.5. What are some sources, particularly here in New York, the sources in New York City? We have a little bit of information that they come from both outside and inside the city. Combustion activity, from burning fuel in vehicles, buildings, power plants, and construction equipment, but also commercial cooking and industrial activities. And then we go a little bit into the health effects. This again is kind of a brief overview, but it explains that they are very, very small particles that can penetrate deep into the lungs and into the bloodstream. We tried to show that a little bit graphically as you scroll down. And then that they can impact various parts of the human body, different organs. Keep on going here. Let me try to get a little bit of information, just pulling from our data portal and also the data study about what are the impacts on health from PM 2.5 in New York City. So that it contributes to about 1 in 20 deaths, contributed for about 1 in 17 asthma emergency room visits, and about 1 in 31 of our hospitalizations. This is a bit of a slightly interactive chart where we're describing that actually 17% of all emissions come from traffic in the city. And if you touch the chart with your mouse, you can get a little bit more information about the percent. So non-road vehicles contribute about 19%. Buildings are actually the highest, contributing about 49%, almost half of our PM 2.5 from buildings. Again, this was back in 2015, so things may be a little bit improved at this point. This is a kind of interesting way of showing that traffic related PM 2.5 is not evenly distributed throughout the city. And you can see here, this is all on-road traffic in our region, the source of it. But if you go here, you can choose different sources. One of the things I'm going to look at real quick, just to give you a sense, is cars. Is that, say, within New York City? Yes. Within New York City. You can see that much fewer are from cars within the city, although there are pockets of the city where there are much higher, use of cars. Then I think it also had outside the city, right? All on-road traffic outside the city. You can see down here in Staten Island, these are probably people coming in from New Jersey, right?
Right, but it's also the wind, it's the transport, the traffic pollution coming from
the jet stream over into New York City.
Well, from New Jersey.
Yeah, so that's kind of impacting the west side of our city, really, here. So anyway, it gives you little things to just kind of interact with as you're going through it, and hopefully pique people's interest to learn more about air quality and health. This is, again, a chart showing the impacts on the attributable health impacts. And then we wanted to really emphasize here for people that there is not equally, the health problems from air quality are not equally distributed in the city, and that poor neighborhoods, PM 2.5 levels from all traffic sources are 50% higher in high poverty neighborhoods relative to low poverty neighborhoods. This is all truck sources, but if you also go here, you can look at trucks and, all traffic sources. Here we can just look at trucks and buses, much higher in low poverty neighborhoods than high poverty.
What?
I think I said that backwards.
You did.
It's much higher in low income neighborhoods than in higher income neighborhoods.
Yeah.
And then I think this is the very last interactive piece that we created, where you can go on to the area in the city where you might live. I happen to live over here, so I'm going to click on there. And it'll show you on the ranking that I'm in an area that has low poverty. So it's, you know, I'm living in Midtown area, but also you can see that the asthma ED visit, the deaths, the cardiovascular hospitalizations, the rate, it's actually fairly low here. If I go somewhere over here, you can see quite a bit of a difference. And you can see where they are in the attributable health events are much, I don't know if you can see that on this thing, but it highlights over here the corresponds here with the neighborhood. So you can see where you are ranking with regards to other neighborhoods in the city. Mm-hmm. And then a place where people can go back and get more information, where they can actually read about the PM 2.5 report, and hopefully get in touch with us. Let us hear about, we've actually gotten, when people are reaching out to our generic email, one of the top topics is always about air quality, right? And requests for information and more data. So I think that's it. But that's all for the presentation. I know we've gone over a little bit of time here.
Thank you, Sarah. Before we go to the Q&A, I just wanted to quickly remind you folks that the recorded webinar will be available on miha.org and our learning management system. Also, to remind you that the previous 3 installments of the chat webinar series are also maintained on miha.org, so please feel free to check resources. I believe we only have time for perhaps one question, and I do have a question for both Kelly and as well as Sarah and Nancy. What are some of the primary challenges that you faced when trying to inform policy based on your work? Sarah and Nancy, you want to take this one first?
I'm sorry, say that, primary challenges?
Sure, yeah. What are some of the...
Well, I would say 2 things. Well, no, one major thing is the fact that our lack of jurisdiction. You know, the health department, because we are not the enforcers of the air code, or we can simply inform, but we can't actually, you know, take action. And then so much of our, for some of our pollutants, like fine particulates, like 50% of our pollution is coming in from outside of New York City. And all of those levels, you know, they're being transported from power plants and traffic in you know, the Midwest, and those are all greatly affected by federal policy. So as we're looking for, you know, as some of the Obama era regulations that would bring about cleaner power generation are being rolled back by the Trump administration, you know, we can't do anything about that, but we know it will increase the air pollution here in New York City. And all we can do is, you know, comment and provide our voice, but we don't have, you know, it limits how much effect we can have on air pollution here in the city.
Thank you for that. Kelly, you want to have a go at it? Kelly, are you there? Yeah, perhaps we've lost Kelly. That's all right. But I just want to thank you to, I just want to say thank you to all of our speakers, and thank you to all of the attendees for taking the time to join us today. We hope that you found value in today's webinar. Please be sure to fill out the webinar survey afterward. We appreciate your feedback. Also, contact information is listed in the chat box. And thank you again for joining us today, and have a great day.
Thank you, Reem. Thank you for everything you did today. It was a lot of work.
Thank you. Bye.